Yeah.
Right. So everybody's okay with being recorded. That's our routine. Click on something on my screen. All right. So good evening, everybody, and welcome to our first 2022 District Dialogues. We started this program, as you probably remember, in February of last year, and held 7 talks to date. And several of these talks were about issues of food equity. We learned about who has difficulty accessing food, the food deserts. We learned how food is being grown in some parts of our city. And we learned some about how those fresh veggies are reaching our neighbors. And the recordings of those sessions are accessible on the village website. So anybody wants to go back, it's there. And in December, one of those talks about related to food was, we heard from Vinnie Houston from DC Greens, a fairly new organization, about the No Senior Hungry bill that's going through a DC legislative process right now. And I think we'll be hearing more from one of our presenters. And this legislation is taking a comprehensive approach to addressing issues of senior hunger in DC. A brief update: the bill B240419 was introduced in October by Mary Chase, 7 council meeting members supporting it. And to quote, the legislation will require creation of a district-wide or communications plan for senior nutrition services to ensure that all available resources and avenues are used to connect with isolated seniors in need of programming and support. Interagency Senior Food Insecurity Task Force, made up of relevant agencies and non-governmental organizations, somebody who is here, serving seniors, will be created. And the legislation will require DC to increase SNAP participation among seniors and to add home-delivered meals and medical nutrition therapy to covered services under the medical waiver for elderly and persons with disabilities. So lots of interesting concepts and a lot of hints at what is going on in the district in terms of helping people with food. And the hearing about that legislation will be happening on February 14th at 10 a.m. That's the Committee on Housing and Executive Administration. And we have some resources through Vinnie, which you could look up on DC Green's website. And we have some things we can share with you. Pass the word to me or Mary sometime tomorrow and days after. So we're already finding out that many our neighbors, fellow citizens in Washington are working on helping their neighbors to stay healthy and fed. I happened to look at Street Sense pages about community services I saved from 2012, 2013, and there are lots of organizations that are helping out. Tonight, we'll hear from 2 of such organizations, Food and Friends and Martha Stable. Both of your organizations, hi Katrina, hi Matthew, have been around for 40 years, right? So you have a lot of experience in helping people. So Katrina Mathis is a director of volunteer services, and she will tell us about Food and Friends and the Food is Medicine movement. Their nonprofit prepares and delivers medically tailored meals and provides nutrition counseling to clients battling life-changing illnesses in a whole DMV, Delaware, District, Maryland, Virginia area. And I rather imagine that medical nutrition therapy is the concept that you probably talk about as you work on things. Now, Matthew Miller is a community activator with Martha's Table. And Martha's Table, quote, supports strong children, strong families, and strong communities by increasing access to quality education, health and wellness, and that includes food, and family resources. They have locations, I think you started in Northwest, and now you have a location, the Commons in Southeast, and both the organizations are well positioned to serve many that need that help. So welcome, Katrina and Matthew, and over to you. And let's hope there is no storm to interrupt our presentations. So, Katrina.
Okay, hold on. Let me see. What am I doing? What am I doing?
Yeah.
Participants can now see your screen. Okay, here we go. Give me a second. Oh, there we go. Okay. Thank you so much for having me here this evening. Thank you, Joanna, for that entry. Intro. I'm sorry, I'm kind of all over the place already. I'm Katrina Mathis, and I'm Director of Volunteer Services at Food and Friends, and we are a nonprofit located in Northeast DC near the Fort Totten Metro Station on Riggs Road. Okay, so who we are. Our mission is to improve the lives and health of people with HIV and AIDS, cancer, poorly controlled diabetes, and other serious illnesses that limit their ability to provide nourishment for themselves. We envision a community where everyone who is seriously ill has the nourishment they need to manage their illness. So Food and Friends is built on the premise that food is medicine and that anyone can get sick and everyone can help. So our nutrition services include, as Joanna already pointed out, medically tailored meals and groceries for people living with serious illnesses. We also provide medical nutrition therapy that's given by our registered dietitians. And so all of our services are provided free of charge for our clients. And our meals are home delivered. And so because they're free of charge, there is no income eligibility. We have clients at all income levels. So we are a very small staff. There are about 62 of us. And of that 62, we have a number of chefs on staff. We also have registered dietitians and social workers among the 62. And that's not enough to do the work that we do every day. So we rely on volunteers. We have so many volunteers who come in every day, 6 days a week, 52 weeks of the year, to help us in the kitchen, to help us in delivering the meals, to help us with some of our administrative operations. Our volunteers more than double our capacity, providing 100,000 hours of service. And again, as I said, that doubles the staff time or the workforce that we already have. And our volunteers are comprised of individuals, corporations, schools, community organizations, universities from across the country. You name it, we have people coming in to volunteer. And pre-COVID, we had about 8,500 volunteers a year. Last year, we dipped down to about 4,500. And when we just ran the numbers for fiscal year 21, we were a little under 3,000. So we've really seen COVID take a bite out of our volunteer capacity. It takes about $13.5 million a year to operate. Again, we do what we do free of charge. And we get grants from Maryland, DC, and Virginia. We get foundation dollars, corporate dollars, and we have a host of individual donors. Prior to COVID, we did have about 3 or 4 signature fundraiser events every year. COVID put the kibosh on those, all except for one, which was our annual Slice of Life Gourmet Pie Fundraiser that we do as a prelude to Thanksgiving. So we sell gourmet pies for people to put on their tables for Thanksgiving, and the cost of one pie covers the cost of meals for a client for a day. So it's something sweet for a good cause. Okay, so this is what we do. Those medically tailored meals, if you're on our service, there are 2 meal plans. There are home delivered meals, or there are groceries to go. Those are the 2 meal plans that we have. Our home delivered meals are breakfast, lunch, dinner, soup, salad, and snack. And those are delivered 6 days a week. And there are 12 different specialized meal plans that a person will get if they're on those meals. Those meals are ready to eat. They are prepared in our kitchen by our chefs and our volunteers. They are ready to eat. When you receive them, all you have to do is pop them in the microwave. Our groceries, on the other hand, are the pantry staples, the canned goods, the pastas, the cereals, the peanut butters, all of those things delivered in brown bags. They are literally groceries. We add some frozen meats and produce with that, and those are delivered every 2 weeks. With those 2 meal plans, the home delivered meals are delivered once a week, and the groceries to go are delivered every 2 weeks. The nutrition counseling and education is a part of either one of those meal plans. And that's just individualized medical nutrition therapy that comes from our registered dietitians for each client that we have. We also offer cooking classes, which have gone online since COVID, and then ongoing education, really to help our clients learn how to manage their illnesses. We also, which is not mentioned here, we learned early on that our clients, because if they're parents, they're going to feed their dependents, even if it means from their own plate. So we supply meals for up to 4 dependents in a household as well. We also include microwaves and blenders for people who don't have them, for clients who don't have them. Yeah. And so it could be, why would a person need a mic? Well, we know why they need a microwave. Why would they need a blender? We have specialized meal plans, and one of them is a soft meal plan. Another is a pureed meal plan. And so it just depends on the meal plan that they're on. We also have a renal or diabetic, a heart healthy, a no fish. You get the gist of it, vegetarian, etc. So Food and Friends started back in 1988 in the basement of Westminster Presbyterian Church. It was when a group of friends came together. They saw a need in their community, and they used that church basement to prepare nourishing meals and deliver those meals to people in need. That was back in 1988. It was during the height of the HIV and AIDS crisis. And it was really, the Food and Friends was really born out of a social justice movement. We recently talked to the founders of Food and Friends, and there were even doctors who would not see or treat a number of the people at that time, or anybody at that time who was suffering from HIV or AIDS. So it was a labor of love. And so now we fast forward more than 30 years, we still have a client base, with HIV and AIDS, but we've expanded that base to include people battling diabetes and heart disease and COPD and renal disease and a host of other life-challenging illnesses. 20% of our clients are people living with HIV and AIDS, 46% have cancer. And, I can't, hold on, let me change this because I can't see the rest of my slides. Sorry about that. So 34% have other serious illnesses. Sorry about my cough. Let me drink something. So 79% of the households we serve have an income that's less than $1,500 a month. So that means that as we are, well, let me finish this. In Ward 7 and 8, which are predominantly Black and African American. Hold on, I got a coughing spell. Give me a second.
Take your time, Katrina.
We're okay. Reading information.
We're all warm and comfortable.
Right.
I'm so sorry about that. Okay, so In wards 7 and 8, which are predominantly Black and African American, there are higher concentrations of poverty and worse health outcomes. So according to DC Health, while African Americans make up 46% of DC's population, 80% of DC residents who have died due to COVID-19 have been African Americans. 85% of those who have died of COVID-19 have pre-existing conditions. And so going back to the 79% of households we serve have an income of less than $1,500 per month. Food and Friends is not, we stay in the lane of providing medically tailored meals. That's what we do. We do know that in doing that, though, we are intersecting and solving some other issues for our clients, such as food insecurity. Because $1,500 a month is not a lot to live on.
Yeah.
Let's see, hold on. Okay, so I don't know, well, I'm sure you all have heard of the Food is Medicine Coalition, and Food and Friends is a part of this coalition. And we're hold on. Food and Friends, we play a key role in the Food is Medicine Coalition, and an association of nonprofit medically tailored food and nutrition service providers. So FEMIC, or Food is Medicine Coalition, research shows how effective our interventions are. So receiving medically tailored meals is associated with reduction in emergency department visits of dually eligible individuals by 70%.
Wow.
The reduction in inpatient hospital admissions by 50%. The reduction in admission to skilled nursing facilities by 72%.
That's impressive.
Yes, it really is.
It really is.
For folks who don't know, dual eligible is Medicaid and Medicare, right? So it's low income older adults, right?
Or any adult. Well, yeah.
Okay. Okay, thank you for stating that. On the 2021 client survey, we asked clients whether they ever worried about food running out before their household could purchase or prepare more, both before they started receiving services and since they began receiving services. So some really interesting facts here, or some stats here. Were worried before receiving services. Clients living with HIV, that was 62.5. If we go down to have been worried since beginning our services, clients living with HIV, that's down to 28%. Were worried before receiving services. Clients living with other serious illnesses, 59% of them were worried before receiving services. 27% of them have been worried since beginning services. And then clients overall, 60% were worried before receiving services, and that is down to 27% who have been worried since beginning services. Okay, so go ahead. I'm sorry.
I just had a question. I was thinking when you're talking about COVID and its impact on the Black community, I was curious, do you ever add illnesses to your repertoire, like, long haul COVID, for example, or is there sort of a focus on illnesses for which, people don't understand long haul COVID, so I don't know that food, like, if there is a medically tailored meal plan for COVID, is like, how do you decide which illnesses?
That's a great question, and you pretty much kind of answered your question. I love the way you just kind of backtrack that. So that's pretty much what it is. We don't know enough about COVID. We don't know if food actually helps COVID, so that wouldn't be one of them. But we actually do add different diseases or ailments. We recently added cystic fibrosis and celiac disease. And sometimes those things will come on because we're in partnership with like the Cystic Fibrosis Foundation, and we'll see how this is going to go for a set period of time. But we have added those two recently, and we are open to adding others. It really just depends on, again, the food component and how that impacts that particular illness.
I did just read that there's an association now they've been able to make between long COVID and unhealthy gut bacteria. So anyway,
yeah,
might be interesting.
No,
What
that's
dietitians
good to
have
know.
to say about that. Yeah.
We'll
No,
have more
that's really
time
good.
for question and discussion, but I think we should continue
Okay.
with
All right.
Katrina's presentation.
So,
Attempting.
okay. So this is just a snapshot of our impact from 2021. And you can go through them. I'll just point out a few. 9.4% increase in new adults and children receiving meals in fiscal year 2021. So we had a significant increase, almost 10%. 60% of individuals reported improved mental health and decreased stress. Let's see, more than 1 million medically tailored meals were delivered in fiscal year 2021. 50% of individuals reported fewer hospitalizations once on service. And so you get the idea. I mean, these are our snapshot of impact that we have seen improvement in our clients. And these are the things that, they're reporting to us. Okay. As a community-based, this thing. Okay. As a community-based organization serving the entire DMV, we serve the 5,300 square miles of the district, Maryland and Virginia. Donating to Food and Friends has a direct local impact. We are neighbors helping neighbors. We really are. We have a community of a small staff. We have a huge community of volunteers, and then we have a community of clients, and we care for each other, making sure that everyone has what they need. So 6 days a week, 52 weeks a year, Food and Friends ensures that our clients never miss a meal. By being a helpful supporter, you provide nourishment and hope to your sick neighbors, their caregivers and dependents, while making our entire community a healthier place. Again, we believe that food is medicine, that anyone can get sick and everyone can help. Let me see, is that the end of my thing? So you can always follow up with me. I am, again, Katrina Mathis, Director of Volunteer Services at Food and Friends. It's a great place to volunteer and work, in case you're interested. That's all I have.
All right, thank you. I think everybody save the questions and maybe start entering them in chat. I think there are a few there already. But let's hear from Matthew, whose organization is doing interesting things on a more localized basis, but yes, Matthew.
Thank you so much. Good evening, everybody. I'm Matt Miller. I'm the community activator in our community development team here at Martha's Table. I work under a branch that we have here called Neighborhood Impact. My work primarily deals with working with the communities to, for one, make sure that Martha's Table retains a high visibility in the community. Also working with communities to build resilience and connectedness through dialogue with community members, community organizations, community leaders, to direct them to all of the resources that we have here, also connecting them and working with the communities with shared interests and values to build networks, to create new relationships, and to maintain or retain engagement between the community and us here at Martha's Table. Do a lot of connecting with the community to develop and build partnerships with other organizations. And yeah, I would love to, Katrina, you just have to shoot your way at some point soon. I really learned a lot about your organization. So you guys are doing great things. So about Martha's Table, we pretty much we started out on 14th Street in Ward 1 about 41 years ago as a safe space for children to access after school meals. We just moved here in Southeast about 3 years ago because the Ward 1 and that side was becoming highly gentrified, and the need to serve over there seemed to it dwindled. We still have a presence in Ward 1 at our Maycroft location on Columbia Road, but our headquarters is right here in Ward 8 in Southeast. And we have a variety of different programs. Today, we are supporting strong children and families and communities by operating a really nice nationally accredited education program beginning at birth. So basically, we'll take children from 6 weeks to 4 years old, or basically pre-K 4, fighting for food injustice and increasing access to healthy meals and fresh produce for well over about 30,000 residents in our communities and outside of our communities. We have people that access our markets from as far as Virginia and some parts of Maryland as well. We also do a lot of work with promoting family success through our Family Success Center and our Neighborhood Impact Program. We've also been able to maintain a community store and a host of engagement programs here. We believe that pretty much every Washingtonian deserves an opportunity to thrive. And so since we've been over here in Ward 8, a lot of programs that we didn't have when we were on 14th Street developed just out of us being over here in Ward 8. There seems to be a greater need here in Ward 8, and we are just, again, making sure that our families, we're committed to making sure that our families here are able to thrive. So with that, I will just sort of run down just a brief description of some of the programs that we offer here. I'll save the food part for last. But our
Looping back.
yeah. So one of our largest programs that we have here is our Early Childhood Education Center. Again, like I said, we serve children from pretty much 6 weeks old to 4 years. In this building, it's a brand new building, state of the art, it's green. Our children here have access to healthy, fresh cooked meals daily. And we have all types of options for children and families that have sort of what you may call non-traditional diets. They're vegan options and things like that. If they're food allergies, of course, as mandated, we have to cater to that. So we're committed to helping our children to thrive here. We also have our family engagement program here, which has several different parts connected to it. But our family engagement program is dedicated to developing strong families. We have a Thrive program here, which since COVID, we've been able to help families that are really having some economic challenges right now. So we've been able to financially help families out through the Thrive program. We have family visiting where, some of our staff will go out and visit some of the families who have children here, and they would go and sort of offer counseling, any type of services that the families would need. Here we are to intervene and to assist in every way possible. There's a lot of areas here that we don't necessarily cover, and because of our strong partnerships, we're able to connect our communities through those organizations who may deal with certain areas. Like, for example, Community of Hope is one of our strongest partners. We can make referrals to them for if a family is having some housing challenges. Community of Hope is one that we would refer our families to. Also in family engagement, we have a partnership with the Capital Youth Empowerment Program, which is a program dedicated to and for the empowerment and development of fathers. So they have a really good Fathers to the Front program. They have a fatherhood sort of cohort program that they do, and it's really good. I've been there a few times where they're really sort of offering a lot of guidance to dads out here that are really just having challenges and just need that support. So we have that. Here at Martha's Table, we also do a lot of anchor events. We do a lot of annual events like the Harvest Dinner. Our Harvest Dinner is one of our largest anchor events because that generally takes place, it takes the place of the Thanksgiving. And we are normally feeding or providing meals, fresh meals to about 3,500 families. In addition to the Harvest Dinner, the same day of the Harvest Dinner, we're able to go out and do pop-ups. We're in three to four different locations here in Ward 8 where we're able to at one different location maybe distribute about 300 to 400 meals per drop. So each year that we've done that, it's been really successful. And that's like our big event that we just look forward to every year, in addition to the Martin Luther King Day of Service. We just received this year a nice grant from Amazon to identify a small community grassroots organization or a community center, and to beautify the project. So we identified two different community initiatives. One was Cedar Heights and one was Washington Highland Edition. And we were able to basically go to those two locations and give them a complete makeover. And these are after school facilities where the children go to, and it's a safe space. So we were able to go along with our wonderful volunteers and beautify those two projects, and it was a unique experience. So that's typically something that we do as well every year for MLK, in addition to our grocery pop-ups, where we also distribute about 300 to 400 bags of groceries to the community on that day, in Martin Luther King Day of Service, in honor of his legacy. We have our neighborhood impact program, a department which I'm a part of. Under that, you have volunteer engagement. So just like Katrina talked about the uniqueness of their volunteers, we kind of have the same thing. And our organization, we couldn't do it without our volunteers. I mean, they really, they spin the wheels around here. I don't know the numbers exactly, but we have a great deal of buy-in from our volunteers. We've even seen some volunteers return and come back. We have a group of special volunteers called Apple Captains. They're like our senior volunteers. We've had volunteers to come and they would, stay on board and be placed in other positions here at Martha's Table. So when our volunteers come here, we try to make it one big, unique experience for them. And that's the takeaway. So volunteer engagement is thriving, and they make the world go around over here. We have a large lobby market here. So So prior to COVID, it was like a pantry market where the community members can come here, take a number, and they would go into the pantry and be able to select a variety of different grocery items. Well, since the pandemic, we've had, you know, just shipments and shipments of food items shipped here daily, and our volunteers they bag the grocery bags with all sorts of fresh produce, healthy canned goods, and those grocery bags they go out into our lobby market area, and so the community, they come to Martha's Table daily, and they're able to access you know, 2, 3, sometimes even 4 bags of fresh groceries. We also have some of our partnering organizations that they'll put in a call and they'll come in and they'll access, you know, 10, 20 bags of groceries, so that they can take them back to their community and issue the groceries to a variety of different senior residences that are out in specifically Ward 7 and Ward 8. We also have a community drop or grocery distribution that I actually personally do myself. Deliver groceries to 3 different locations. 2 of them are partnering organizations, and actually 4. 2 are partnering organizations, and the other 2 are senior residences. One is at Highland, and the other one is Roundtree. So we're able to go there every Thursday and provide anywhere from 60 to 90 bags of fresh groceries every Thursday. And that's nonstop. Sometimes they have to call us and say, I can't take but so many onions, you know, because the onions are really big, and you can, you know, pretty much keep an onion. I don't know how much you cook with it, but yeah. So that's thriving very well. We have our community development team, which is the team that I'm a part of, and we're, you know, actively out, you know, putting together anchor events. We also have a fitness program within community development. Our largest actually being our senior fitness program that we have every Tuesday at 10 o'clock, I believe, and that's all done virtually right now. And then our next largest is our Go Zumba class that we have. That's oh yeah, Go Zumba is pretty big and it's pretty hot. And anybody can partake in it. It's all ages. That one is in person right now, right here at the Commons on our terrace. And yeah, it's typically about 30 to 40 women out there just moving and, you know, just staying active to that homegrown DC go-go beat. So we do promote fitness as a part of wellness as well. Our Outfitters program, which is, it used to be basically our Martha's Table thrift store, but it's converted now into a program or platform that supports families and also people who are preparing for job readiness. So we have a partnership with the Department of Employment Services, and if, you know, folks that come through that need clothing for interviews, or they may need like professional clothing for their day-to-day job, they can put in an order here, get a voucher, put in an order, come to Outfitters, and they could pick up suits, they could pick up slacks, dresses, all types of clothing. Families can do that as well for their children. We just had a family that called us 2 days ago. No, it was over the weekend. I got a call from a partner who had a family that had a fire, so they got completely burned out of their apartment or their home, and so they wanted to know if they can access clothing from us. The answer is yes. We don't turn anybody away, so we just had them to send their sizes and their genders, and we put together loads and loads and loads of bags of clothing for them. So that's also a part of the work that we do here at Martha's Table. Again, like I said, when we moved here, our programs began to grow. So we now have the Anacostia Success Center, which is dedicated to working with families that are also in economic need. Any type of plug for families that need resources in other areas. That's what our Anacostia Success Center is for. We have a new community nutrition program. We have our emotional wellness and mental health program, which is also new. So we're able to partner with organizations like Community Wellness Ventures and get assistance to people who are in need of emotional wellness. So we have emotional wellness workshops. We have workshops for people that are dealing with or healing from trauma. We help people to heal from trauma. And we also have a brand new program where we offer individual counseling for people who have Medicaid. So it's free of charge. There's no cost to this. So these are things that are thriving here at Martha's Table. Now on to the food portion. We have our wonderful Joyful Food Market. Our Joyful Food Market is a very unique program that goes into Ward 7 and Ward 8 public schools, and they provide nutrition education for children, and they teach kids about healthy recipes, just different alternatives. In addition to that, and they give cooking demonstrations on site. And in addition to that, they have, I don't know, X amount of hundreds of those grocery bags that I shared with you earlier, where when the parents come to pick their children up from these schools, they're able to access these grocery bags and to take away and to go home. So this pretty much saves a family from having to, go to the grocery store to buy certain things. They still have to go to the grocery store, but we're well aware of the food insecurities that are here in Ward 7 and Ward 8. And so this is our Joyful Food Market is just one of the things in addition to our lobby market, just a few things that we try to do to combat those food insecurities. Of course, we also have our thriving McKenna's Wagon. McKenna's Wagon has probably been with us since day one. You may have seen the Martha's Table van out in the streets and just out there serving the people who are without homes. Now that goes beyond Ward 7 and 8. You'll probably see us in Ward 5 and Ward 6 with the vans parked, and you'll see a line, and we're providing healthy meals to our communities of people that are without homes. And so that's been going on for a very long time. That operates 7 days a week, Monday all the way around to Monday again. That's also operated by our unique volunteers. So we have volunteers that come in every day, and they get the van, and the van's already loaded with the food, and they drive the van out to the community, and they distribute the meals to the people. And that's been going on for a very long time.
Okay.
That's pretty much what I have for you guys today. I've also left my information in the chat a little earlier, just in case you have some other questions that you'd like to ask. I'll be more than happy to answer, help, or direct you to the right sources.
Thank you. That covered a lot of ground because you're doing a lot of different things. And I think many of us will be going back and looking you up online and learning more as we go along. Matthew, you also mentioned a video. Do you think we have, and Mary Bladworth, do we have time for that video? What do you think, everybody?
It's up to you guys. I know you have questions, and I knew we had the video scheduled, and I just wanted to make sure I got through the time.
Right,
So I apologize for that. So
no, yeah. Perhaps we should field a few questions. Mary, can you look in the chat and ask, or how does it work?
I was going to say, if you want, you can just put the YouTube link in the chat, and people can access it that way. You don't have to, yeah.
Okay, all right. Mary, can you look at the questions, or can I do that? I can do that.
You can do that. Sure you can.
Well, start from the top and keep going. Susan asks, how does someone become a client of Food and Friends? And she also asked where, okay, we'll start with that.
Great question. So to become a client, clients are referred. And so a referral, you can do it online, but a referral takes place from either a doctor or a healthcare plan or a social worker or someone like that. So a person can't self-refer, but we do have an eligibility quiz online, so a person can see if they're eligible. But that is how a person gets on our service. Again, it is all health-based. It is not income-based at all.
Right. And you've been around long enough to the word has spread out, and those doctors and maybe organizations know to refer you. I think, and you have such a broad reach, it's interesting to think of how the word spreads around. And I will continue because I assume Martha's Table being more local, the word of mouth and walking by the commons, and Susan asks where it's located exactly, that becomes, well, people find out about what Martha's Table is doing, or walk by that Martha's Outfitter store. Yes. So,
okay. I'll put that in the chat, but our commons location is located at 2375 Elvins Road, Southeast. So we're up on that hill. Where we are feels like a mountain from MLK to the top. If you're familiar with the Our Lady of Perpetual Help Catholic Church, we're sort of parallel. So, from my office, we can overlook the entire city. I'm not bragging, but it's just we're up on the hill. So that's where we are. Our outfitters location is 2204 MLK Avenue. Our outfitters
it's
location.
right in Anacostia, yeah.
Exactly, right. Sort of diagonally across from the big chair. So our outfitters location right now has been well, as far as the outfitters part of the outfitters location, that's been kind of inactive since COVID.
Yeah.
So outfitters have kind of moved here in the commons. So we do use the outfitters building for different meetings and small anchor events and things of that nature. Our Maycroft location is located on Columbia Road Northwest. So we still do have a presence. It was at 15th and was at 1400. I'll have the address, but it's right at 15th and Columbia Road. So we still do have a presence there. That's primarily just for early childhood learning, but in Ward 1. Yeah.
Okay, I'm trying to see what else we have here. Okay. I'm having, I think, hard time seeing all the questions. So over to the audience. Questions, thoughts, reactions? And unmute when you want to speak and maybe hand up. Mm, right. And there was a question about, I'm sorry,
There was a question about how families qualify for the groceries that Martha's Table.
for the
distributes.
Martha's Table, okay.
Yeah,
Yeah, no need to qualify. Everyone has free access, so you just come up and just grab.
Fine, how I
And
make-
if you want to get like a bulk or something like that, definitely you can call the front desk, or you can just reach out to me, shoot me an email. Like I said, I left my information in the chat, and I'll make sure that that you get an adequate amount of groceries or your requested amount.
Right, right.
can I throw a question? Oh, go ahead. Yeah.
Judy, you know, go ahead, Judy.
I was going to ask Matthew and Katrina, what your reaction to to No Senior Hungry bill, if you've sort of thought about it, and how it meshes with your experience of what's working and what's not working in the district.
I'll probably go first before you, Katrina, because I don't really I'm not even privy to that information. I didn't know anything about it until just sort of hearing about it recently, and I think food is, we all have a right to that. It's like we have a right to air, so yeah, the fact that there is a bill being passed, I mean, I'm like, how did we even get there? Because this is an essential part of our daily survival. And we all have a right to that. So I advocate for any living creature having access to just those things that we require to survive. And it's as simple as that with me. Yeah.
Yeah.
Oh, Matthew, why didn't you let me go first?
Because you're a tough act to follow. That's why.
No, because you have so much more to say about this than I do. Like Matthew, I found out about this today when Joanna sent out she sent us some information ahead of the call, and I didn't know anything about it, so I apologize. I don't have anything to share about it.
Yeah, well, then look it up, learn about it, because what I found interesting, and I find interesting through all these talks, is how much activism and organizations are there working to help people. And that bill, and actually there's something else in the works, similar, is trying to help to coordinate these activities, to help people know about where the help is. So I think that is interesting. This one is focused on seniors, but I think the right to food is not just seniors, but there are already seniors being fed. So let's make sure that we reach all of them. And I think that should spread to all age groups. On the other side, you, among other things, Matthew, help feed people. I am aware of organizations that actually help collect unused food. And I think it's primarily from supermarkets, but I think also maybe from restaurants, and then process it, use it, and then distribute to people that need it. Obviously, you're aware of it, but does either one of your organizations take advantage of that? We know that there is a huge amount of waste going down, into solid waste stream, and Marian Bowser would be very upset about that. I'm sure is. Were you able to take advantage of it? Are you?
Yeah, from what I know, we have been always, been able to take advantage of that, especially if it's, well, as long as if it's like a donated item within date, of course. So I've seen that. We also receive we've received for months, like right after COVID, right after the initial outbreak. We had an organization called Rethink, which is it's like a food catering or something. They provide healthy hot meals for like 1 or 2 restaurants in DC, in addition to the Clyde's restaurant, the famous Clyde's. Yeah,
That sounds familiar, yeah.
yeah. So for months they were providing us daily hot meals every single day. So in addition to the just the regular groceries that people would be able to come and access, they would also they would be able to access those hot meals as well. And even when we would go out and do the food distributions or the food drops or the food pop-ups, we would include those healthy warm meals as well.
Right,
And those
right.
things came in handy because as I said before, we have our McKenna's wagon. Well, we don't have McKenna's wagon doesn't operate here in Ward 8. And so when we would do the food drops, which are here in Ward 8, one of our locations is on Martin Luther King and Malcolm X at UPO, and across from there is I think it's like a shelter that's housed in the old St. Elizabeth's facility.
Oh,
And
yeah.
so a lot of those people there would be able to come out and across the street and have access to those same healthy hot meals, and they
Right.
really appreciated that.
Yeah, yeah.
Can I just say, with regard to that, what Food and Friends does is we get some donations. We don't get a whole lot of donations because we buy all of our own food. The donations that we do get, we use to feed our clients. But what we do to avoid waste, and we actually have a green initiative going on now, but we were doing this before that, is that we have staff delivery drivers, we have staff people who deliver meals. We also have volunteers who deliver meals to clients. And anytime, and the staff go out in refrigerated vans. Our clients go out, our volunteers go out in their cars. So once meals have left the building in a volunteer's car, we cannot take them back. We don't take them back.
Right.
So if a client misses a meal delivery, and we can't find anyone else to give the food to, we have listed different organizations that will receive the food. Police stations, fire stations, whatever. We do whatever we can not to trash that food.
Of course, right. Yeah.
And then sometimes we'll try to give it to another client, but of course you don't want to give a client who's on a renal diet a regular diet. So you have to look at all of those different things, but we do go out of our way to make sure that we are not wasting.
Of course, yeah. But it's complicated. Susan,
Yeah.
I think you have a question. Unmute Susan. Okay.
Sorry, I was hitting the wrong thing, but it was a thumbs up on the ways to avoid waste, and very good work.
Oh, thank you.
Yeah. But yeah, I was thinking more on the source. There is the sell by date on all these products and Safeway and Giant and so on. And I know at least of one person who is making a living working for an organization, collecting those things and delivering somewhere. And I should check with her whether that's still going on, I imagine. So there are those sources of more bulk foods that hopefully reach people's stomachs rather than Fort Totten waste station. Yeah. Okay. Well, I think we are close to running out of our time. A couple more questions, perhaps. And I have a little announcement to make after that.
Okay. I had a question for oh, go ahead, somebody.
Oh, no, go ahead. Go ahead.
Yeah, I wanted to ask Katrina about the, does Food and Friends, I think you also, that you do education for your clients. Do you do more general education? I mean, I can imagine that there's probably, members of the village who would love to know more about, cooking tasty, healthy things, that are for, just
Yeah.
good, healthy for, and particularly, around just, aging and how you absorb nutrients is different and, other things.
That's a great question. No, we don't, but we are a very nimble organization. I think everyone is much more nimble given what we've been through the last 2 years. So
Yeah.
with having to manage all those changes, that is definitely something we'd be open to.
Mhm.
And Katrina, can you do me a favor and include your information in the chat?
Oh, sure, sure,
Um,
sure. You do likewise. Oh, no, yours is already there, right?
Yeah.
Yeah.
Well, I'll put my, I have
And
it.
everybody knows how to look it up. And well, also when we post the recording, I think we'll have your contact information, probably link to the website, etc. So that, and I expect that we'll have an article about it in a newsletter. So we'll work on that. Anything else? If not, then thank you very much, Katrina, Matthew.
Thank you.
Thank
And
you.
it
Great
was great.
program.
Thank you so much.
Thank
Yeah.
you.
Very impressive.
Yeah.
Thank you so
And,
much. Thanks for having us.
Yeah. And announcement, we thank you, Susan. We already have a program gelling for February. And we've been often reminded in these talks that good nutrition is necessary for maintaining good health. Food is medicine. But I start asking a question. Is our medical system set up to provide these medical waivers that are included in No Seniors Hungry bill? How good is our medical system? Big question mark in my mind. So we will hear something about that, quite a bit, in February District Dialogues. And we'll hear from Ambrose Lane, Jr., founder and director of DC Health Alliance Network, and from Dr. Valda Crowder from Capitol Hill Partners. And they'll be talking about healthcare and how well or not so well is working for various communities in the district. We're not 100% sure as to time, whether it's 7 to 8 in the evening, but we'll be working on that. So look for updates. And again, thank you all and have a good evening.
Thank you.
And see you
Thank
in a
you.
month.
Thank you, Joanna,
Thank
for
you.
bringing these folks to us.